A 34-year-old man presents with burning, erythema, and blurred vision after cleaning liquid is splashed in his eye. Which of the following should you do? A. Be concerned about acidic burn. B. Be concerned about alkali burn. C. Postpone irrigation until confirmation of the type of cleaning liquid. D. Use a meiotic agent. E. Use copious irrigation until a pH of 7.4. Answer is E. Use copious irrigation until a pH of 7.4. When a chemical injury to the eye is suspected, regardless of the offending agent, copious irrigation should be started immediately. Irrigation with water or normal saline should continue until the pH is at a physiologic level, approximate pH of 7.4. All but the mildest burns should be treated with a long-acting cycloplegic, a mydriatic. A patient presents to the emergency department complaining of severe burning of both hands since leaving her building this morning. In her history, you find out that the metal doors of her housing complex had just been cleaned of all rust. She has small blisters on her palms and a white appearance to the skin. What is the next step? A. Consult plastics for an alkali burn. B. Leave blisters, cover with bacitracin and gauze. C. Mix calcium gluconate with KY jelly, apply to hands and cover with gloves. D. Obtain pain control and prescribe oral clindamycin. E. Treat as a second-degree burn. Answer is C. Mix calcium gluconate with KY jelly, apply to hands and cover with gloves. The rust cleaning and physical findings are descriptive of a hydrofluoric acid burn. It is also commonly used in the production of microelectronics, etching glass, for removing rust, and for cleaning cement and bricks. Calcium gluconate, 2.5%, gel is the preferred topical agent. However, this gel is often not available in hospital pharmacies, but it can be made by mixing 3.5 g calcium gluconate powder in 150 ml of a water-soluble lubricant. The gel should be secured by an occlusive cover, such as a latex glove. In a hydrofluoric burn, what electrolyte abnormality causes systemic manifestations contributing to this chemical's significant morbidity and mortality? A. Hypercalcemia. B. Hypermagnesemia. C. Hypocalcemia. D. Hypokalemia. E. Hyponatremia. Answer is C. Hypocalcemia. Hydrofluoric acid binds calcium and magnesium ions with strong affinity. Systemic manifestations of fluoride toxicity are at least partly related to hypocalcemia and include abdominal pain, muscle fasciculations, nausea, seizures, ventricular device rhythmias, and cardiovascular collapse. Of note, hyperkalemia is often a terminal finding in fatal cases. A 29-year-old man presents by emergency medical services confused and hypoxic. Vitals signs are blood pressure 100 by 70 mm Hg, heart rate 120 beats per minute, respiratory rate 22 breaths per minute, and an oxygen saturation of 83% despite 100% oxygen via non-rebreathing mask. The arterial blood gas is reported as venous. You see the syringe and note that the color is a chocolate brown. Which of the following should be the next step? A. Determine the methemoglobin level and prepare methylene blue. B. Methylene blue intravenously. C. Sodium thiosulfate intravenously. D. Urine assessment for Win-Rose coloration. E. Wood's lamp to aid in the diagnosis. Answer is A. Determine the methemoglobin level and prepare methylene blue. The patient is suffering from methemoglobinemia. For those symptomatic patients without glucose, 6-phosphate dehydrogenase deficiency, 2 ml per kg of 1% methylene blue can be administered over 3 to 5 minutes. Symptoms typically improve within 20 minutes. Severe cases can be treated with exchange transfusion. Candidates for exchange transfusion include those with G6PD with significant toxicity from methemoglobinemia or those patients who fail to respond to methylene blue.